Good afternoon, class of 2016. Congratulations on a successful journey. We did it, and today is our day to celebrate. A special thank you to Dean Finnegan, our distinguished faculty, the Office of Alumni, Susan Scrimshaw, family members and friends for joining us at our graduation from the University of Minnesota School of Public Health. I am here today representing a member of a trailblazing group of pioneers, the first cohort of the new Executive Public Health Administration and Policy Program. We are a group of mid-career professionals from multiple states who've been able to connect to this fabulous top 10 public health school through on-campus sessions and online learning. Making this training available to mid-career professionals brings public health skills to established healthcare workers and at the same time injects life experiences into our learning environments. We can be proud of the school for expanding its impact and presence in the public health field, and we look forward to watching the many lives the new program will touch. We would like to acknowledge our first program director, Rebecca Wirtz, and Donna McAlpine and Ira Moscovitz for their dedication and courage to make this program a reality. We are University of Minnesota Public Health, poised to reframe public health as a solution, a success story, and strategic actors who are strong enough to stand with our country's most disadvantaged. We are the emerging Chief Health Strategy Officers for entire communities where we promote healthy living. Our journey in public health began here in Minneapolis, where we have shared a great last few years together in a dynamic learning environment with access to strong education, faculty, and ideas. Now, however, it's our time to leave this outstanding university and to enter a new challenging world. So, what will this new world look like? In many places, people are living longer, but not necessarily better. We also know that in rural areas, which comprise 14% of our nation's population on 72% of its land space, that they continue to have the highest premature death rates. We know that things like the chronic disease burden, diseases we can often prevent, continue to have negative impacts, and that risk factors for health among different subgroups are not the same. The data continuously reveals that we have important work to do. We, the class of 2016, have important work to lead. Our friends from the County Health Rankings and Roadmaps program tell us that characteristics like where you live and socioeconomic factors have an impact on 80% of our health, while medical care, an extraordinary expense, influences 20% of our health. Now, our Masters in Health Administration classmates here with us this afternoon know that it takes $3 trillion to achieve the 20% influence on health, and that we desperately need for them to manage this precious community resource well. However, to achieve real success in health, we all need to examine and make further investments in the social factors that influence the 80% of our health. To help you think about your role and where you might fit in, I have a few tools that may guide you in this journey. The first tool is a hard hat. While you may not have thought you went to school to be in the construction business, please think again. We all need to build bridges, teams, multi-sector partnerships that can help solve public health's most wicked problems. Healthy people have greater productivity in the workplace, and healthy communities are more rewarding places to live. Your hard hat may also be helpful in building more team-based care solutions that involve a wide spectrum of professionals and providers and other social service supports to address and solve our most pressing community health issues. Health systems, too, have great opportunities. No, actually obligations to be bridge builders through their expansion of community clinical linkages to improve health. The second tool you will need is a dictionary to help the various sectors understand the different terms like healthcare, public health, population health, and community health. Better common understandings of these terms is essential to harmonize multi-sector efforts and help to further build support and commitment from other partners in your plans to increase community health. The third tool, and my favorite, for your toolkit is a big dinner fork so that you can be at the big people table and with the adults. The important work we must do can only be accomplished by being leaders and working with key community players, including mayors, business leaders, United Way, health systems, and other nonprofit, government, and philanthropy professionals. To make this happen, you, the new public health or health administration graduate, need to gain literacy in these sectors. You need to know their dreams, ideas, and concerns, and begin to design a new blueprint for community health together. We need to join Rotary, community health coalitions, important committees where decision makers invest their time. The skills, knowledge, and network you've built are critical to community health design and problem solving and demand your presence, a strong voice at the adult table. The last tool I would like to leave you with is a stepping stool to reach for health equity. Many of us are from populations at risk. We need to find ways to make communities acceptable and authentically safe for all of its members. Certain groups may need more resources than others. This is necessary. For in the end, to make durable health improvement, we need to raise the health status for all community members. Health inequity anywhere is a threat to health equity everywhere. In addition to the tools, we know that things like smiles, laughter, jokes, time for reflection, and celebration of milestones really matter a lot. So strive to thoughtfully incorporate them into your work environment every day. Throughout this message, you have heard terms like multi-sector partnerships, team-based care, and community clinical linkages, phrases that point to the need for collaborative efforts among people, teams, sectors, and communities. The work I am leading in Wisconsin to develop a new community health fund also seeks to harmonize community health improvement through braiding together funds from various resources. We need everyone to lead and to grow beyond their comfort zones into new, non-traditional circles of decision-making for community health. With the passing of the Affordable Care Act and a national prevention strategy, we have new opportunities for public health professionals to take the reins and be real leaders in health, real leaders in life. I'm here today representing members of my family, including my 3 boys, my personal football team, whose lifespan may be at risk if we do nothing. This is really important work we have to do. Our time is now. We have the skills, we have the conviction, and we are ready to leave the university. Failure is not an option as we lead toward more fair and healthier tomorrow for our families and future generations. We are University of Minnesota Public Health, and we are ready. Let's do this.